So this is a chronicle of day 4. My last was at the second day, and this is day 4. I'm just being kept in a little longer because of the steroids they gave me. Ran up my blood sugar, so they're just monitoring that. But otherwise, I'm doing pretty well. I'm able to kind of walk around the hospital, find all the shops and things, and kind of hang out a little here and there. In the hospital, of course. But things are going pretty good. Energy's been coming back steadily. So doing pretty well. Just waiting to get discharged whenever they finally decide to let me go. They're just continuing to monitor things and determine when it's best to let me out. I did want to mention something I didn't mention before. If you're a CPAP user that needs the acromegaly pituitary tumor surgery, then you won't need to bring your CPAP with you to the hospital. You won't be using your CPAP for a good while after your surgery, so you don't even need to bring it to the hospital. If they ask you to bring it to the hospital, tell them to talk to your doctor. Many of the nurses that did pre-op for me were mistaken, saying bring your CPAP, and I said no, you go talk to the doctor. And once they finally got around to the doctor, they all realized that I don't need the CPAP, and you won't need the CPAP for months at least again, because they don't want any high pressure air going up the nose after they do that surgery. While I've been in the hospital, they have been at night to help address the sleep apnea somewhat. They have been giving me a little small amount of oxygen, small amount of CO2 at night when I go to bed. That's been it, and it's a real light mist of CO2, and it just helps to keep the oxygen level right while not disturbing the incisions where they've done that surgery. But everything's moving along good. Everything's moving along good. I'm feeling real good, and just kind of waiting and seeing and letting them do their thing and their due diligence, and I'll do maybe another video sometime later. Thanks. So still on day 4, just a few minutes after I finish that video, doctor comes in and says that I can go home, and since I've been here 4 days and they see I'm doing pretty well, that I can go home by myself and be okay. So they were thinking that I'd be discharged earlier and I would need someone to watch me a couple days, but now doing well enough to be home alone, and I'm feeling pretty good. Like I told them, I've been wandering the hospital halls out of boredom, getting the lay of the land of the whole hospital at this point. So doing pretty good, and thanking God I'm able to just go home and relax and get some sleep, because here in the hospital, when they're poking you all the time, checking every vital all the time, you don't get as much sleep as you like. So just gonna go home, thank God, relax.